Alright, so I'm confused about something. So I was in the hospital the last few days, and they diagnosed me with sepsis and pulmonary edema. See right here, um, sepsis due to unspecified organism. Um, See, then look, we got another little note here. Sepsis alert. Right, so if I go back here and look at my um, test results, so when I went in on the 13th, they did all these tests. They did ECG, that was normal. That was normal. COVID, flu, all not detected. Um, I've been sick for a while. And, well, where we get in is the blood test. Before I do that, though, here's the chest x ray. Mild interstitial infiltrates edema. Scroll further down. It says here there's mild interstitial prominence compatible with infiltrates edema. Could be related to a viral pneumonitis, which is basically pneumonia. Okay, so now let's look at the blood tests on the 13th when I went into the hospital. So here, well, there's nothing wrong here except the glucose is a little elevated, but that's because the medicine they were giving me. Now here, the complete blood count. White blood cells are high, neutrophils are high, and monocytes are high. That usually indicates infection, at least according to Google. See, having high white blood cells, absolute neutrophils, and absolute monocytes strongly indicates that your immune system is highly activated, likely due to a recent acute infection, systemic inflammation, or severe stress. Okay? So they put me on IV steroids and antibiotics. Um, Now, they ended up releasing me 2 days later on the 15th. Right? But that morning of the 15th, before releasing me, they did another blood test. Once again, white blood cell count is high. In fact, if we look, it's actually. So this was the 13th, 12.67, 12.62 on the 15th. The neutrophils were high again. In fact, they were 8.79 on the 13th, 9.13 or 9.13 on the 15th when I left. Monocytes were high again. They were a little lower though. 1.51 on the 13th, and now they were 1.04 when I left. So the new one here was this immature granulocytes. So on the 13th it was 0.07. When I left it was 0.14. Now, when I looked that up, so this means your bone marrow is rushing early stage white blood cells into your bloodstream to meet high demand. This is most commonly caused by a severe bacterial infection or acute inflammation. It can also stem from bone marrow disorders, tissue injury. Okay? So most common cause, particularly bacterial infections or sepsis. Right? Now, let's look something up here. Yeah, keyboard. Sepsis is a primary cause of interstitial infiltrates and edema. Alright, so they released me without any antibiotics. How does that work? Clearly, I'm fighting an infection that has caused, or that has turned sepsis, and I have no antibiotic to show for. Can somebody explain that to me? Like, I'm not a doctor, I'm not a rocket scientist, but I'm pretty sure the signs here are basically pointing towards I should have an antibiotic. Like, this is new. On the 15th when they released me, having this. See, it wasn't there on the 13th when I went in. See, look. I don't know, dude. Like, these... I'm lost here. I'm confused. You know? I don't know, dude. I just don't know. But, yeah. It's crazy. It's crazy.